Good afternoon, everyone, and also good morning to our West Coast colleagues. My name is Ben Rempel, and I'm an analyst with the Person-Centered Perspective and Prevention team at the Canadian Partnership Against Cancer. I want to thank you for joining us in the second of our two-part webinar series on policy actions to prevent cancer. In today's webinar, we will be discussing policy actions to reduce alcohol-related harms. Today, I am joined by two colleagues, Dr. Heather Bryant and Dr. Jacob Shelley, both of whom will be introduced in a few minutes and will make up our panel for today's session. I also want to take this time to wish you happy Pride and also recognize June as National Indigenous History Month. The head of office of the Canadian Partnership Against Cancer is located within the city of Toronto. Toronto is on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. It has been an extremely difficult time for our Indigenous friends, family, and colleagues as we continue to learn more about mass graves at the former sites of residential schools. We know this is just the most recent reminder of centuries of injustice faced by Indigenous people. As we gather today from across Canada during Indigenous History Month, I encourage each of you to acknowledge the lands you work, live, explore, play, love, and laugh on, and express gratitude to the original stewards of this land. To begin, a few housekeeping announcements. You may turn on subtitles for this webinar in English or French by selecting the settings button on the bottom right of your screen. All attendees will be muted throughout the duration of the webinar. Please write any questions you have through the Q&A feature, which can be accessed by clicking the question mark button on the top right of your screen. Following this webinar, a recording and the presentation slides will be shared with attendees. To begin, a bit about the Canadian Partnership Against Cancer. The partnership is a federally funded pan-Canadian health organization that works alongside provinces and territories and other partners to promote equitable access to quality cancer care and cancer prevention initiatives. The partnership acts as the steward of the Canadian Strategy for Cancer Control with an aim to accelerate action in this area. Our efforts are focused on the long-term objectives of reducing the incidence of cancer, reducing the likelihood of dying from cancer, and improving the quality of life of those affected by cancer. Priority one of the strategy, decreasing the risk of people getting cancer, is where efforts of alcohol policy are situated. Feel free to review our website to learn more about the role of the partnership in reducing cancer in Canada. For today's session, I'll provide some brief comments to set the stage, with most of the time reserved for a facilitated discussion on the role of alcohol policies in the prevention of cancer. Much of what will be presented today is captured within the recently released web resources through the partnership, which you will find on our website at the link on the slide. These resources include key statistics, health economic evidence, data on populations of interest, an overview of policy actions and related legislation, along with commentary on the influence COVID-19 has had on alcohol policies across Canada. I invite you to review and utilize these resources to inform your work. At this time, I also wish to acknowledge the many people involved in the research, the writing, reviewing, and publication of these resources. The Health Ethics, Law, and Health Lab at Western University, McMaster Health Forum, Tim Stockwell, Aaron Hoban, Heather Bryant, and Catherine Paradis as volunteer reviewers, and several teams across the partnership, including communications and digital marketing, translation services, and our analytics team. Thank you to the many hands that went into the production of these resources. In addition to these resources, 2021 has already been a busy year in terms of positive activity in the alcohol policy field. Several organizations, including the Canadian Public Health Association and the Canadian Centre on Substance Use and Addictions, have held virtual seminars on alcohol policy and the COVID-19 pandemic, including current data on consumption and trends and related harms. Canadian Public Health Association is in the midst of updating their alcohol policy position paper, set to be released this fall. Also, several pan-Canadian groups are planning a fall forum on alcohol policy, cancer prevention, and public health. I encourage you to stay tuned for more details on this to be advertised soon. In early 2022, we are expecting release of a revised national alcohol strategy and renewed low-risk alcohol drinking guidelines, both initiatives spearheaded by the Canadian Centre on Substance Use and Addictions. And globally, the World Health Organization is currently consulting with member states for accelerated action to reduce the harmful use of alcohol, and is in the process of developing an action plan for 2022 to 2030. This, of course, is not an exhaustive list of all the great work currently being done, but rather just a snapshot in time of positive directions in the field of alcohol policy, public health, and cancer prevention. To begin our discussions around alcohol consumption and alcohol policy in Canada, we have a poll on the screen. So feel free to jot down your answers and we will review the answers on the next slide. So the first question is, what percentage of Canadians 15 years and older consume alcohol? 70%, 80%, 90%, or 100%? So feel free to jot down what you feel the correct answer is. Second, how much alcohol on a per capita basis is consumed in Canada? 6 liters, 7 liters, 8 liters, or 9 liters? And lastly, what contributes to alcohol consumption? Jurisdiction, sex, age, indigeneity, sexual orientation, socioeconomic status. Those are the options listed on the slide. So we're going to review, so take note of your answers and we'll review these on the next slide. According to the Canadian Tobacco Alcohol and Drug Survey, alcohol is the most used psychoactive substance in Canada. In 2017, nearly 80% of Canadians 15 years and over reported consumption of at least one alcoholic beverage in the previous year. A recent study from the World Health Organization suggests Canadians consume alcohol on a per capita basis far greater than the global average, 9 liters compared to 6 liters. Also, alcohol consumption varies across a variety of factors, including all of those listed here on the slide. Alcohol is classified as a Group 1 carcinogen and is estimated to be one of the top 3 causes of cancer deaths worldwide. It has been estimated that nearly 3,300 Canadians were diagnosed with alcohol-related cancers in 2016. Evidence indicates regular alcohol consumption over time, even at low levels, increases the risk of developing alcohol-associated cancer. It has also been found that cancer risk increases when alcohol is combined with other factors, including tobacco use, unhealthy eating, and a lack of physical activity. Research supports a causal link and increased relative risk between alcohol consumption and cancer at 7 sites in the body: oropharynx, larynx, esophagus, liver, female breast, colon, and rectum. And emergent evidence suggests alcohol consumption might increase risk for other cancers as well, including cancers of the pancreas, lung, and prostate. Despite research and media attention, Canadians are generally unaware that alcohol is a carcinogen. A 2016 public opinion survey conducted in Quebec and Ontario found that less than a third of respondents were aware that increased consumption is associated with alcohol-related cancers. Heavy drinkers have been found to oppose alcohol policies, which limit access and availability. Research has demonstrated that when the public is informed that alcohol causes cancer, attitude towards evidence-informed policies shift. For example, a study published in 2020 found that if participants were aware that alcohol caused cancer, they were more likely to support policies, including stronger controls of marketing, availability, and price. So what can be done about these concerning statistics? Our second poll is displayed on the screen here with the question of what is the strongest policy lever to prevent alcohol-related harms, including those from cancers? Is it pricing and taxation, availability and outlet density controls, marketing and advertising restrictions, or an increase to the minimum legal drinking age? So again, jot down or mentally note which answer you feel is the correct one. Research outlines that pricing and taxation policies appear to have the greatest effect on consumption and therefore harms. But it is important to note that all of these policies listed on the slide are important to pursue. In fact, the Canadian Alcohol Policy Evaluation Project argues that 11 domains can effectively contribute to the safe sale and reduction of harms of alcohol. Implementing such policies doesn't only make sense from a health standpoint, it also makes good economic sense. The policy levers of taxation, controlling outlet density, strengthening government monopolies of alcohol sales, and implementing marketing restrictions have all been shown to be cost effective while simultaneously reducing alcohol use and related harms. Informed by evidence, there are numerous recommended policy actions federal, provincial, and territorial and municipal governments can take to minimize harms. For example, a municipality can utilize zoning bylaws to limit the number of outlets serving alcohol. This can include legislation around the types of venues and proximity to schools. A second example includes mandating health, nutrition, and safety messages on alcohol products. This information appears on nearly all other products sold for consumption, except for alcohol. Many other policy actions exist, and we encourage you to explore these to inform your work. Our research included an analysis of Canadian provinces, territories, and municipalities which have implemented alcohol policies to reduce harm according to evidence-informed policy domains. This slide outlines examples of municipal jurisdictions which are taking policy actions to reduce harms throughout their communities. Many more examples exist, and we encourage you to review the resources on our website to learn more. The next few slides showcase examples of municipal action to reduce the harms associated with alcohol. Working with partners, Wolfville, Nova Scotia has implemented a community alcohol strategy to educate the public about high-risk drinking and harm reduction strategies. Brampton, Ontario has a municipal alcohol policy which prohibits alcohol advertising at venues attended by those under the legal drinking age of 19. And events held within the City of Toronto must provide health and safety information on safe transportation programs, low-risk drinking, and the dangers of consuming alcohol during pregnancy. Each of these examples are consistent with a recommended policy domain to have a meaningful effect on consumption patterns and reduction of harms. Many other examples exist across Canadian municipalities. These are but a few highlights. Although positive signs exist, Canada is still operating within a pandemic environment, and there have been amendments made to many alcohol policies due to COVID-19. For example, Ontario has expanded the hours of sale that alcohol can be purchased in restaurants and bars and has permitted the delivery of alcoholic beverages. Curbside pickup of alcohol has been permitted in Ontario, Saskatchewan, Quebec, and New Brunswick. North Vancouver permitted drinking of alcohol in certain parks. And in some jurisdictions, there has been a reduction in minimum pricing. At the same time, efforts to reduce transmission of COVID-19 has brought changes that may have a positive impact. For example, provinces have limited the hours of service at restaurants and bars or imposed limits to overall capacity. It is unclear at this time whether such policy changes will revert to pre-pandemic models or remain in place. When discussing COVID-19, it's important to note that the data here is rapidly evolving in this area, and only time will dictate the true influence on long-term consumption and harms. To help track these changes, I would draw your attention to the Canadian Centre on Substance Use and Addiction, which has compiled a suite of evidence-based resources on the influence of COVID-19 on substance use. We recommend visiting their website to keep your knowledge on policy changes current. So we'll now move into our facilitated discussion on the role of alcohol policies in the prevention of cancer. To assist with this, I would like to introduce our two panel members. Dr. Heather Bryan is an expert advisor to the Canadian Partnership Against Cancer, a clinical professor at the University of Calgary, and a leader in the development of cancer system performance reporting in Canada. Prior to joining the partnership, she was vice president of the Population Health and Information at the Alberta Cancer Board. Dr. Bryan studied medicine at the University of Calgary, followed by a fellowship in community medicine and a PhD in epidemiology. Dr. Jacob Shelley is associate faculty with the Rotman Institute of Philosophy at Western University, while holding a joint appointment with the Faculty of Law and the School of Health Studies. He also serves as co-director of the Health Ethics, Law, and Policy Lab out of Western. His primary area of interest is the limits and role of law in promoting public health and preventing chronic disease. He has a doctorate in law from the University of Toronto and obtained his LLB and LLM from the University of Alberta. So welcome to both of you. We received a ton of questions from participants in advance of this webinar, which is fantastic. Feel free to also submit questions to the Q&A board, and we're going to try our best to get through as many as we can. We've allotted a lot of time for the facilitated discussion period because of this. So we're going to move into the Q&A at this point. So as a way to begin, I'm going to ask each panel member, and I'll start with you, Heather, to please turn on your camera. You can unmute yourself, say hello, and what I'd like you to do, briefly speak about why the topic of alcohol policies and the prevention of cancer is such an important discussion to have.
So I just would like to say, first of all, Ben, thanks for the great overview. I think it's a really important thing to examine as we move forward. Policies are things that we know in public health are much more probable to influence the change that you want to towards healthy behaviors. And so with tobacco, for example, we knew for many, many years that tobacco was a risk factor and tried to use education and other things, but really it was policies that started turning the tide and really reducing the use. The problem that we have with alcohol is it's not quite as amenable to policies as tobacco is in a number of ways. First of all, it is something that is, it's not necessarily an all or none kind of thing as tobacco is. There are elements of its use that do harm other people, such as driving under the influence and drinking and driving, but others, such as what we're discussing mostly today, the chronic low-level use that may contribute to cancer, doesn't have that lever. So it's really important to discuss it because the policies that we would have to put in place are really policies more akin to policies in the food area than in some of the other areas of public health, and they'll take a lot of work to discuss together. So I'll pass it over to Jacob.
Thank you, Heather, and thank you to Ben and the team at CPAC for inviting me to participate today. It's a great question, and I would echo what Heather says about kind of the, and I'm getting used to using the language of a wicked problem, right? And alcohol is a wicked problem in many ways, and this doesn't mean it's evil. It means it's very difficult to solve. And policies are a really important mechanism, particularly when there are other influences that are driving things like consumption. And this will probably come up in other contexts in our discussion today, but we've normalized the use of alcohol. We've become very accustomed to. In fact, one of the things that most of my friend group has celebrated in the reopening in Ontario was patios. It's patio season. We demarcate our life based around often the consumption of alcohol. And the reason why policies are so important is that we have not really talked about the risks beyond what we understand to be the risks of drunk driving or maybe domestic violence. We have had discussions, and they're important discussions in society to have, but most people are not aware of the other risks attendant with consumption of alcohol, and certainly are not aware of the risks with cancer. And I can say from my own work on this policy pack, I was well aware of those risks, but working on this policy pack has shifted my own relationship with alcohol in a more positive way, because it's hard to ignore the evidence of the dangers, and it's hard to kind of minimize the impact. But we know as human beings, and we know this from food and from other areas, that it's very hard to resist the nudges and the pushes that are exerted on us in society, the social pressures. And I think policies are a really important tool that can be used to shape the environment, to not only identify the risks and help people become more aware of them, but to act to mitigate them in the interests of those who might not be personally motivated or may not have the opportunities or resources or whatever it might be to kind of combat the other influences on their consumption. So Alcohol policy and cancer prevention, I think, will be a pretty big discussion in the next decade in health promotion and public health communities, because it's one of the areas. For many years, I've joked with many of my public health counterparts that we've talked a lot about tobacco, but we don't talk about alcohol because all of us drink, and most of us don't smoke. And so it's a little bit more close to home, and I think we need to start having a bit more of a frank conversation about alcohol.
Great, thanks very much for those comments, Jacob and Heather. So, like I said, we had a lot of questions submitted ahead of time. They are all very difficult to answer, so prepare yourselves, Jacob and Heather. This will not be an easy 40 minutes for you. And we have a few questions coming in through the Q&A board as well. So I think I'm going to start with one from the Q&A board, and then I'll go back and forth between those that were previously submitted and those that are coming in now. So Heather, I'm going to start with you. The question is, what recommendations do you have for population level messaging around alcohol consumption and cancer prevention?
So this is one that's actually trickier than it would probably sound, because as Jacob has said, there's lots of evidence around, but the evidence isn't quite as unilateral as you would like it to be, to make a simple message. So there are those that are messaging that it's best not to drink at all. But the evidence tells us that while there are many cancers that are influenced by alcohol, and there are some that are influenced at pretty low doses, and that includes cancers of the mouth, pharynx, esophagus. Very low doses will influence those. Other cancers actually are influenced at higher doses of 2 to 3 drinks a day before you start to see the risks go up. And still others look to be preventive for cancer. So renal cancer, non-Hodgkin's lymphoma, and lymphomas actually alcohol appears to be protective. And even the World Cancer Research Fund, which is one of the groups that is saying it's best not to drink at all, acknowledges on their website now that in renal cancer there's the evidence. So I actually think it's important not to overstate and to say alcohol is related to the cause of several cancers. And we do know that it increases the risk for these cancers that I've mentioned. With breast cancer, there's good level of evidence, although the level of increased risk is small at the low doses of drinking. It's only a 1.04 relative risk, which essentially means if you have a 12% risk of getting cancer, breast cancer in your lifetime, it would take it up to about 12.5%. And for some cancers, the low dose, it looks like it doesn't at all. Colorectal cancer, which kills more people in Canada, it actually at low dose doesn't have an effect, but at higher dose. So clearly you don't want to be giving all those nuances in a public health message. What you want to be saying is alcohol does carry a risk, especially for these cancers, and that it should be used in moderation. And by moderation, it's lower than people think. So most groups are going towards the 1 drink a day for women, 2 drinks a day for men as being the outside. I also think another important thing, and it's starting to come out in some public messaging that we should be pushing more, is the idea of at least 3 dry days a week. And the idea behind that it comes from giving your liver a rest, but it also, I think, is important for not habituating the use of alcohol. Just as Jacob has said, you kind of get used to, you get home, you have the glass of wine to relax, and once you start habituating the use, it's difficult for people to stop it. It's difficult for people to moderate, and I think that's something we have to include in our messaging.
Okay, terrific. Thanks very much, Heather. We're going to stay on the line of on the topic line of messaging. So I'm going to go to you, Jacob. I'm just going to publish the question. So Jacob, the question is, knowing that some healthcare organizations, and this is what Heather was starting to get to, some healthcare organizations have messaging that state that there are health benefits to drinking alcohol, but knowing that there are negative effects when it comes to cancer, how do you integrate that nuanced messaging into policy?
Yeah, this is a very difficult challenge. We could probably spend the entire webinar talking about this and still scratch the surface. I think one of the things that we've done in public health in general, and this has been written about in the last decade in particular, is that we've too heavily relied on tobacco as a model for how to regulate. And we've too heavily relied on tobacco as an approach to how to think through policy. And just before this webinar, we were having a bit of a spirited discussion for a minute. We can disagree on some things with tobacco and on the fringe margins of cases, but the reality is there really is no safe exposure to secondhand smoke or to smoke. And there is an approach that says, just having no tobacco products is probably the safest and healthiest. It's a lot more complicated with most other products. And we see this in food, we see this in alcohol, we see this in cannabis, we see this in other illicit drugs. We also see this in vaccinations. This is part of the ongoing discussion we're having right now, that there are risks attendant upon vaccination. Sorry, I have kids at home learning today. But we have this challenge now to navigate explaining risk when it's not no risk, it's low risk or higher risk. And and as part of the challenge for institutions that have to develop policies, it's a bit more of a nuanced discussion. And so that really starts to speak to not only how we approach evidence, but what kind of evidence we actually need to gather and how we use that evidence to frame policy. So there's a lot more I could say about this, but the trade-off, if we're talking about the healthcare benefits to the negative impacts of alcohol, we can have that discussion. I don't think we need to shy away from there may be evidence emerging or suggesting there are benefits, but the benefits are always going to be around low levels of consumption. They're not, so we can at least gear towards, moderate to high consumption is not beneficial in any way, shape, or form. That more nuanced position is harder to do in policy because we've become a little bit complacent, thinking that we can just regulate our way out of problems without having more difficult discussions. And I think this is where we need to start to move away from the model of tobacco sometimes and how we regulate, and think a little bit more critically about how to integrate those complex messaging. But high consumption is a risk, period. We can actually start there. We don't have to start with the low levels. We can talk about where the risks are going to materialize and then work our way back to say there are maybe safer levels of consumption. It's never going to be no risk. It'll never ever be no risk, but it'll be lower risk at these levels, and things like what Heather is suggesting about, dry days, having a couple of days a week where you don't consume any alcohol. For many, that's not a reality whatsoever. And I think there's opportunities to talk about how to mitigate risk rather than to eliminate risk.
Okay, terrific. Thanks very much. We're the Q&A board's heating up now, so we're going to stay on the line of messaging, just because a lot of the questions are around that. So obviously there's a great interest in that. So we'll just stay on that, and then we'll go to a different topic area in just a minute. So Heather, the next question's for you. Can you just speak about evidence around harm reduction messaging versus abstinence messaging?
Yeah, I think that's actually sort of what we've been talking around in our conversation. We are talking about harm reduction when we're talking things like limit your use of alcohol to 1 or 2 drinks a day, depending on gender. And, actually, there's a lot of people think that we would be farther with our messaging if we didn't put that nuance into it and just said, look, a drink a day is enough for everybody. Or 7 to 10 drinks a week. And so you can spread it out as you wish. The level and quality of evidence we have to say short episodic drinking versus the chronic use is what's amounting to these increased risks of cancer is something that we have to disentangle a little bit yet before we start looking at those messages. But I do think we're talking about harm reduction in the field of cancer. I think it's a lot easier in alcohol when we're talking about unlinking it from specific behaviors or unlinking it at particular times of life, like pregnancy. But talking about this long term is different. The cultural thing is interesting. I know that there are some provinces, for example, that have low-level drinking guidelines, but then say, but if you're at a party, I try not to have more than 4 drinks. Now, that doesn't have much to do with cancer risk. That has to do with what are likely going to be the acute risk factors with it. And we have to recognize that the kinds of interventions for that limit one won't necessarily limit the other. Now, I see the other thing is talking about stages of behavior change. And of course, one of the very first stages of behavior change is awareness. You have to be aware of the behavior that you want to change towards. And I think many people have said there's not a good awareness in the public of alcohol and cancer risk, and there's not an awareness of it's a low chronic dose probably that is the problem, not the over drinking on the weekend that we tend to focus all of our public policies on.
Okay, terrific. Thanks very much, Heather. Okay, Jacob, I'm going to turn to you still on the, well, we're talking about everything at once, I guess, costs, harms, benefits, and messaging. But this one's a barn burner of a question. So we'll see what you come up with. Has there been any work to start class action lawsuits against governments for their failure to inform the public about alcohol's known cancer risks, similar to what we've seen with tobacco?
So there's been discussions about these, to be sure. My colleague Robert Solomon at Western University has written policy briefs on this in the past or memos. So it's not that it's not been considered, but one of the challenges we currently have in any sort of thinking about using the tobacco class actions as a case study is that they're not done. They have never been vetted to the point where we know the outcomes. They're still kind of in limbo. So I think there's a lot that potentially may arise once the provincial lawsuits against tobacco companies or lawsuits against provinces are moving forward. There's a lot of kind of uncertainty. The challenge also with class actions is that, you know, the current structure, and this is a much broader question. So whoever asks that, please look me up and send me an email, and I'm happy to engage with you more on this. But the current structure of class actions doesn't necessarily allow for that because, number one, you have to demonstrate, you know, commonalities, and there are different levels of consumption, different products that are being consumed, and even though there are major players in the alcohol industry, akin to the tobacco industry, alcohol also has this other kind of sub-industry of craft industries, but also home production. People that home brew or make your own wine at home. And should the government be doing more? And the responsibility of the government here, you know, it's hard to sue the government for policy decisions. It's actually, you can't. You can only sue them for operational decisions. So it's complicated, but there might be opportunities to kind of pursue this, but they would be decades and decades in the making. And so it may be a strategy that could be employed. And I certainly am on this in the side of someone who likes to use private law and product liability law to hold institutions and organizations accountable. But I think it certainly isn't going to be the way to solve this. I think because there's so many other complicated factors to this. And there's also a degree to which, you know, it requires knowledge on the part of the state, and we can make a case for that in more recent times. But unlike tobacco, where it was well documented, well known, and to some extent ignored, the same history isn't quite there. So there are some challenges with using that approach. Is it a potential approach? I think there's possibility. Do I think it's the likely or most meaningful way to approach this? Probably not. I think the more likely thing to do is to try to hold industry directly accountable, Now, that gets complicated in places like Ontario, where we would kind of, where's the distinction between the industry and the retailers? But, and that's what makes this a very complicated conversation. But class actions are a possibility, but it's not likely to bring about results. And those that have watched the tobacco lawsuits for the last couple of decades, I cut my teeth in law school writing about tobacco litigation that has never, ever gone to trial. And I went to law school almost 20 years ago. So, it's a slow moving process to engage with to bring about real change.
Okay, thanks very much, Jacob. I'm going to stay with you and just pick up on some of the points, and a question that was given to us before the webinar and also during here, like a version of it, is just simply just comment. There's questions around why isn't alcohol labeled and restricted in advertising the same way as tobacco products? If it's a known carcinogen, as tobacco products are labeled with images and graphic images and messaging related to that, how come alcohol is not?
Well, there's a variety of reasons for these but a lot of it has to do with industry influence. We know this from having watched the playing out of the warning label study done in the Yukon by Hoban and colleagues, where the industry directly influenced the decision about whether to continue with labeling. But there is this also complicated relationship between the government and industry that, we have many provincial governments that are, profiting off the sale. And so there's maybe think in Ontario, where I'm currently situated, one of the platforms of our current premier was Buck a Beer, right? It's about trying to make alcohol more accessible and interesting, policy options that would, from our perspective, be problematic, but seem to garner public perceptions of being a good thing, cheaper alcohol. And so I think there are some real challenges with approaching something where there's such a relationship between the industry and the government. Industry capture here, regulatory capture is a real issue, I think, though, that we have to talk more about. And the interference by the industry in the Yukon study made international headlines because there's clearly influence and lobbying, and I think there's sometimes not enough attention given to the role of industry in this space. I know Heather wants to jump in, it looks like.
Yeah, I was going to turn to Heather, so please go ahead, Heather.
So I think that is important, and the role of the industries that profit from anything, of course, are going to be interested in preserving their market share of that. But I do think that we shouldn't be naive. These are not equivalent in terms of the link between the carcinogen and cancer. With tobacco and cancers, many of the relative risks are 10-fold, 20-fold. So they increase your risk by 10 or 20 times. And when we have the evidence from the biggest meta-analysis that people are quoting now for breast cancer as being 1.04, you just don't have the same smoking gun. And you especially don't have the same smoking gun when breast cancer is also related to higher body weight and other factors that are very difficult, that are lifestyle factors that would be difficult to disentangle. So if you're going to go forward with labeling, if you're going to go forward with those kinds of messages, my advice would be, let's make the labeling about esophageal and laryngeal cancer, where you've got a better quality of evidence and a higher relative risk to deal with. Because once you start getting into it's just a carcinogen and causes all cancers, it's a difficult thing to act on in the kind of litigation you're talking about.
And I think if I can jump in on that real quick, I think that speaks to also, if we actually want to have strong cases, we have to make a strong case. If we present evidence that can be used in a counterproductive way, right? If there's too much thrown out there, I think Heather brings up a great point. Like, I think if I was working for I always try to think, if I was representing industry, how would I dismantle this argument? It'd be relatively easy to dismantle some of the arguments based on the evidence, because it's not as strong as sometimes the claims are made.
Okay, terrific. Thanks very much. Yes, a very complex question. We had 3 answers for the question. Okay, Heather, I'm going to stay with you, but I'm going to shift to questions more focused around policy actions. So the question is, how would you approach advocating for alcohol policies when the general public and potentially politicians may not be in favor of this? For example, increased pricing, taxation, etc.
Well, again, there's no reason that they would be in favor of it unless you have the evidence that it's actually causing health impacts. And so I do think we have enough evidence to say that that is the case. We did have policies that went into place about drinking and driving, and that took after many years of lobbying. Although interestingly, many of those policies has more to do with traffic control and the drinking part of the equation, or the driving part of the equation, than the drinking. But there are rules about, not allowing somebody who is obviously drunk in your establishment to get out and get into a car, or you're partially liable. So some of those policies have worked for that. So I think as I'm kind of lost the thread. Do you want to just restate your question there?
Yeah, of course. How would you approach advocating for alcohol policies when the general public probably isn't in favor of them?
Well, I think, again, I think you have to advocate based on evidence. You have to be able to put together the evidence, not only for cancer, but you have to discount some of the other things about the overall health benefits of low risk. The second thing is that price increases will affect more people who can't afford alcohol as easily. And we do know in Canada, for example, that higher income people are the ones who are more likely to have risky behaviors in the cancer instance of that drinking more than 1 drink a day for women, 2 drinks a day for men. And so getting the argument that this might be one way that's a bit of a deterrent, I think is a useful thing for governments to look at. And I think if you have the evidence that looks at some of these patterns of behavior, you can make it stronger. It's not, it's clearly it's not a slam dunk.
Yeah, okay, great. Thanks very much.
If I could add to that, Ben, I think part of what, I play this social experiment a lot in my life where I ask people to tell me how many drinks they're having when they're having one. I ask them to try to guess. And I think that there's not just a lack of awareness about the risks, but I think there's truly not a lot of awareness about what a drink even means anymore. And so I think there is, sometimes it's a soft answer to say we need to educate people more, but there is a degree here where the work being done around the low risk alcohol drinking guidelines and such is really, really important because it frames the discussion that make people more receptive, if not to strict regulation, but maybe to increased regulation or have an awareness. And I think most people don't identify themselves as heavy drinkers, but when you actually start to look at the data, a lot of my circles, they're heavy drinkers or they're binge drinking and not realizing, because they think of what media or other narratives might suggest heavy drinking is. And so I think it's about informing the public a lot about what heavy drinking actually looks like, and it's actually a lot less drinking than people might imagine. And so, and especially with the movement in some areas, like the craft brewery movement, like beers have gone from being small cans to being tall boys. All of a sudden, we've increased alcohol consumption, and people are still saying this is one beverage, one drink. And so I think that there's basic literacy issues here. There's a lack of alcohol literacy that I think can then make people more receptive. And that's also been shown in the evidence that as people are more aware of some of the risks, they start to be a bit more receptive to the policy change.
Great. Thanks so much, Jacob. So we're going to stay on the line of policy actions and questions to that. Jacob, you mentioned before that legal pursuits are maybe a 10 or 20 year effort. And so the question we received ahead of time was, where should initial efforts be placed to maximize our impact in the short term, affecting policy change, over the next 1 to 3 years, sort of thing?
Well, I think it's going to what I was just speaking to some extent around literacy. I think that there's going to be specific policies that are needed towards specific issues that may arise based on jurisdiction or population. There isn't a one policy response here that will solve everything. So when I was thinking about this question in advance, my answer was, I think one is about increasing people's awareness about the risk and about what the low risk, alcohol drinking guidelines actually are and how they will operate and what they mean. And we've seen success in this respect with regards to drunk driving, where there's a new generation of young people that are far more aware of the risk of drunk driving than their parents or grandparents were because of educational efforts. So that can go a long way. The second thing I think, though, that there's a lot of opportunities, and it's written about in the policy packs, are municipal alcohol policies, these maps, because municipal governments are a bit more nimble, a little bit easier to implement change quicker, and can be more responsive to specific community needs, and tend to have the ability to get more buy-in because their local representation stays locally. They're not going to Toronto or to Ottawa or to the centralized area for legislating. And so there is a bit more opportunity, I think, with municipal governments. And so I wouldn't think about a policy per se, but about the policy actor in the municipal governments and what they might be able to do to make, maybe small, but still nevertheless meaningful changes, how they allow alcohol to be consumed at municipal properties or in events, or the advertising restrictions they may place on their own infrastructure and so forth. And these little kind of changes will start to change the broader narrative. It will still take time, but I think that's where I think a lot of activity could come. I also am a big proponent. The work I've done, I've long been a big proponent of warning labels, but not government mandated. I think there's a private law obligation for manufacturers to warn consumers about the risks. And there was a lawsuit many years ago in California that argued that that alcohol manufacturers didn't adequately warn about the risks, and it lost. But one of the things that came out of that maybe could be pursued is that was the risk of a consumption of a lot of alcohol. And the court said, well, everyone knows you shouldn't consume too much. But the real risk here is the moderate consumption. The consumption that is encouraged is actually the danger. The consumption that is portrayed in media by alcohol companies and industries, by even, the drink menu, specials, etc. All these things are geared towards moderate consumption, and moderate consumption still has risks. And so we might want to focus our efforts on those types of things. But I think a lot will start at a municipal level. I think there's a lot of power there.
Okay, terrific. Thanks very much. Heather, I'm going to turn to you for the next question on the Q&A board. Often in Canada, the alcohol industry is consulted in the policy process. What role, if any, should the alcohol industry have in shaping alcohol policy?
Oh, that's always tricky to answer. You really shouldn't have, I don't think, any provider involved in the evidence analysis part of it. And the interpretation of the evidence. The evidence is the evidence, and you come up with what's there rather than having arguments and mitigating what you're going to say is the actual level of risk. Where it might be helpful in getting industry involved would be if you can come up with a policy that industry also backs and doesn't cause problems with. I suppose that's worthwhile, but it's always difficult in these kinds of things. In this way, I would say in this whole conversation, we've done a lot of parallel drawing between alcohol and tobacco. And really, alcohol has a lot of parallels with foods. And we do know that even in the development of food guides, that various food industries have been involved in trying to get their food moved up the food guide, and that has caused difficulty. And so I do think it's better to have all of the industries absent from the evidence analysis, and maybe just provide reflection on the impact of the recommendations made, but I don't know that they should be helping to formulate them.
Okay, terrific. Thanks very much. Okay, we're going to move in. Jacob, I'm going to move back to you, and we're going to talk about COVID-19. So a question we received ahead of time was, what influence has COVID-19 had on alcohol policies in Canada? I gave a very brief 30-second slide on this in the introduction, but can you detail that out a bit? What are you seeing? What are the dangers? What are maybe some promising points in that?
Well, so we've seen, depending on the jurisdiction, some pretty significant changes, you know, and some of these have been in efforts to mitigate, you know, people having to go out or to help supplement businesses that were struggling. So they had maybe laudable purposes behind it. And some of it was because of the reality of people's dependency on alcohol. So a really important one that's been part of the COVID discussion was the declaration of alcohol as an essential service in jurisdictions as they went into shutdowns. And that was deemed to be problematic by some. Although when you start to unpack that, you understand that there might be reasons for this, but it does raise some really interesting questions for us to reflect on. That if alcohol is essential, like why is it essential? Because it in the you know fundamental kind of understanding of essential, it certainly is not, right? So it's been made essential, it's been rendered essential for a variety of reasons, and I understand the arguments behind people that have dependency or that may have addiction issues and requirements, but there may have been other ways to resolve that. But we've also seen some positive and negative kind of policy shifts. So, you know, we have seen at the times there was reduction in serving hours or opening hours that, you know, prevented potentially or an amount of capacity in a restaurant or a bar that would prevent overconsumption in particular locations at particular times where it's encouraged. And we've also seen, you know, curbside delivery and door delivery. I had full disclosure, I had a 2-4 of Wellington Brewery, one of the craft brewery in Guelph, delivered to my house one day because I couldn't get out, and I'd never done that before, and it felt so strange. And then it happened, and suddenly now it becomes normalized to be able to be home. And I've had colleagues and friends who were at 10 o'clock at night order alcohol to their door, and so that is changing our accessibility to it. And we know that increased accessibility to alcohol for some populations will result in increased consumption. It won't for all, but there is some evidence to suggest that if you're at the high end of drinking and the amount of the quantity of consumption, and now you have more accessibility, that might push you into a higher category yet, into a problematic area. So, and then we've seen some relaxing of some rules around, for example, in British Columbia, of alcohol in parks. We've seen that same discussion happening in places in Ontario of tailgating, and so it does send signals. It's signaling to society that alcohol is not only a normal and accepted, but a necessary part of our interactions. And I think that actually is something that we need to reflect on post-COVID. It's unclear truly, you know, what will happen post-pandemic still. We don't know whether we'll revert back to the pre-pandemic. I suspect that curbside delivery and door delivery alcohol is here to stay in Ontario. I have a hard time seeing breweries being, you know, but I don't know what will happen. Obviously, none of us are able to tell the future, but I think it's an opportunity to talk about, you know, as we prepare for potentially the next pandemic, which is inevitable in time, what do we think about this idea of the essentialness of alcohol? How do we better prepare if there are those that require, you know, alcohol, you know, and we saw the long lineups of the LCBO when there's concern they might shut down, people stockpiled, and then people consume more because they had more. And so there's all sorts of signaling that happens with even the way we talk about some of these products. And so the impact of COVID, you know, we've seen an increased consumption. The stat that comes to mind, I think, was out of BC, where there's a 40% increase at the beginning of the pandemic. It will be interesting to see how that, again, plays out over time. You know, we see a lot of discussion now of people talking about returning to healthy lifestyles post-pandemic, how that will be translated into alcohol use. It will be interesting because we also now are seeing increased parties and patios and restaurants, and there's this new excitement to go out and experience things. So it's yet unknown the policy implications long term, but in the short term, there certainly were things that would be causes of concern that will lead to increased consumption by just simply making alcohol more accessible. And accessibility is a big part of consumption.
Right. Okay, great. Thanks so much, Jacob. We are nearing the end of our session. This flew by. We trust people are getting the information they were hoping to get, and thank you for being active on the Q&A board and for submitting questions ahead of time. Heather, I'm going to ask you the final question, and then we'll need to wrap up because we are almost at the top of the hour here. So the question that we received ahead of time from a participant is, if we know what policies work best to help reduce alcohol-related harms, what can researchers and other health professionals do to ensure policies follow the evidence?
Well, I think again, there is a willingness to enact policies if there is good level evidence. But I do think that we have to be careful that we don't lump a lot of things together and lose the power of our message. So I think it's very tempting. It's a much simpler message to say no alcohol ever. But that is not going to be a policy that is going to be implementable. As you know, as Jacob's already said, it's seen to be an essential service. But I do think that we can look at some of the ability we have now with some of the transient changes we've had. So Jacob talked about a lot of these. Let's remember that the reason we have a lot of these changes in alcohol policy over the time of the pandemic is because they haven't let us have people in our house. And so a lot of behaviors that were considered to be, we don't want to make it look like it's part of life. If you're going to have alcohol, you have to have it in your home. You're not going to be having it outside. But we only let people get together outside. And so that was why those policies were put in place. So how fast can we be to go to the governments and say, okay, well, that's over now. We can get together in our house. So let's take that one away, because there were all sorts of good reasons for that policy, including the normalization of the behavior and the potential impact on people who aren't your guests and all those other sorts of things. So I actually think our first order of the day is to start working on the reversal of those policies based on the fact that the needs for those policies will be gone with the pandemic. I mean, I'm sitting here in Alberta. I am still unable to have anybody in my home, but on the 1st of July, there will be no restrictions whatsoever. It seems like a big step to me, but I do think we have to say, okay, if we've gone to that, then we don't need to be drinking on the beaches anymore, and we don't need to be doing these other things because all the other limitations that made those necessary are no longer there. The other thing I'll just say is we need to collect better data. So we need to know more about different groups. We need to know the difference between disappearance data that we often have to use. And we need to have better ways of getting to self-reported data that is accurate so that we can actually help influence these policies more down the road.
Okay, thanks very much, Heather. And thanks as well, Jacob, to you both for those very informed answers. And thank you to our participants for those very difficult questions. So we're going to wrap up now. We're just at a minute to the end. So as we do wrap up, I want to thank our two panel members, Heather Bryant and Jacob Shelley, for sharing their expertise in this area. I also wish to thank each of you as participants for your engagement and terrific questions on this complex and very important topic. I'm going to leave the webinar with a quote from one of our resources. Reducing consumption of alcohol requires a multi-sectoral approach, including the implementation of evidence-informed policies. Only a comprehensive and coordinated response to alcohol consumption trends and harms will have a substantial and positive impact in reducing the risk and incidence of alcohol-related cancers in Canada. So with that, that concludes our webinar. Thank you very much for attending. Stay safe and take care.